Hello. Good afternoon, everyone. How are you today? I trust God that you're fine. And I believe you're good. I'm so excited to see you today. It's been a long while. Well, first of all, I really want to apologize for not being online for so long. I think the last time I came online was in May. Yes, this June, I'm not sure I have come online. I just want to apologize. I have other things I'm also doing, and that is actually taking my time. So, my apologies. I won't go off this long again. And for today, the class was for 12, but by my time now, and I think it's 12:32 or thereabouts. I'm so sorry about that. The rain came and interrupted so many things, so I couldn't start the class on time. So I'm so sorry about that. So I'm back. Today is Trisha's voice, and with you today is Ambassador Patricia Godwin. Today I'll be talking about female genital mutilation. Uh, it's a great topic, it's a concern. It's something we should talk about. Some persons may want to say, I was so much about this topic. There's so much about this topic. Female genital mutilation. It's something we should not ignore. It's something we should create awareness. It's something we should talk about. It's something that is taking our society back, and it's something that is really affecting the girl child, the female, and all the women. Yes, because as long as you are a woman, one other woman's pains is yours too. So you have to be a part of my voice to say no to it. And we are going to talk about it. After the class, you would get to know why the World Health Organization decides that there should be nothing like female genital mutilation. You will get to know why doctors are fighting against female genital mutilation. You get to know why people and NGOs are fighting against female genital mutilation. So today I want to give my voice on this topic too. What I feel, what I think, and what the world is going through, what women are actually going through on this. So, first of all, I want to talk about mutilation. What is mutilation? Mutilation. Okay, let me just say mutilation means the infliction of serious damage on something. It is an act or instance of destroying. Mark the word destroying. Removing. Mark the word removing. Or severely damaging a limb or something part of a person or animal. Mutilation means alternating something. You understand? Mutilation means destroying something. Mutilation means removing something. So what is that thing that has been removed from a girl child that is very significant? It's exactly what I'm going to talk about today, and that is female genital mutilation. So in this context or in this topic, the mutilation I'm talking about is on the genitals of a woman, the genitals of a girl child. The damage is done to that part is what I want to talk about. We'll be talking about what it has, the damages it has caused. We're going to talk about the causes. Why do you go into this act? We'll talk about those reasons. And we're going to talk about the consequences and the effects of all these things. Do they really have effects? Do they really affect people? So that is what we are going to talk about today. So, and I go straight to the meaning of female genital mutilation. What is female genital mutilation? You can decide to say female circumcision. People say female circumcision, but I like using the word genital mutilation because it is specific. It is specific. I feel if you say female circumcision, it may sound like somebody will say, what are they circumcising? Some persons may not really understand. But being specific about the area we are concentrating on, which is the genital, is the part I like. And that is very direct. So, Oxford Language Dictionary defines FGM. If you don't want to go through the long pronunciation, you just say FGM. As the practice, traditional in some cultures, mark the word some cultures, of partially or totally removing the external genitalia of girls and young women for non-medical reasons. Mark the words, for non-medical reasons. Now I take that again. Oxford Language Dictionary defines FGM as the practice, traditional in some cultures, of partially or totally removing the external genitalia of girls and young women for non-medical reasons. That is to say that this part that has been taken out, medically, it is not advisable. That's what that point is talking about. It could also be called female genital cutting. You can call it that way, female genital cutting. World Health Organization, WHO, defines FGM as procedures that involve the partial or total removal of the external female genitalia. Underline the word external, female genitalia, and or injury to the female genital organs, either for cultural or any other non-therapeutic reasons. Non-therapeutic reasons. That's the definition by World Health Organization. Now, what that part is talking about is, we know how the female body works, and I'm so sorry. I included it in the flyer or in the poster I made the other time for this class. That this class will accommodate children, it will accommodate parents and the aged. I always like bringing old people into my class because some of the things I teach can be traced back to some years, can be traced to years back, you get. So those old people will help us, explain to the younger generation what I'm talking about, especially like this topic. It's a topic that was very it's a problem that was very rampant, in the old days. So I feel the old people will be here, or they should be able to understand what I'm talking about, so they can also pass the information to younger generations who doesn't understand. So as a girl child, I want you to watch this program also and learn, so that anybody who wants to abuse you, because I see that as an abuse, you will let the person know that this is against the law, and I'll tell you how to go about it in my class right now. So I will not go too far. When we talk about genital mutilation, what are we talking about? It means that there are some parts in the woman's genitalia that has been cut out. And that is we have the labia majora, we have the labia minora, we have the clitoris, we have the clitoris hood, and there are other things there. So those are the parts that are being mutilated, cut off, based on some reasons and some belief. In the course of this class, you will get to know why people do that and the consequences that are involved. So I'll go straight to the types of female genital mutilation. I'll go to the types. The first one we have here is clitoridectomy. Clitoridectomy. So what is clitoridectomy? This means removing the clitoral hood. Clitoral hood in the female body. I didn't want to bring a picture of something so that, because I know that I'm going to actually use some words that I may not know how to control, but I have to just say them. I plead it flies, So, I don't want to bring the picture here, but in the female body, there's a place we call clitoral hood. It's up like this. So, clitoridectomy is the removal of that thing, that hood up. It's like a skin. Some people say foreskin and all that, So that is it. And at least part of the clitoris, this is also called ritualistic circumcisions or circumcision. Ritualistic circumcision. Why do we call it ritualistic circumcision? Number one is that it is somebody will say you're using the word rituals. It therefore means that they have to kill somebody will have to die and all that. It doesn't mean that. It's a ritual, it's like a rite, something that should be done traditionally. Something that should be done traditionally because it has to do with the removal of that spot I told you. So that's why people term it that way. You understand? Based on the nature of it. Now, intro case, the clitoris is nicked to cause bleeding. This is the least harmful type of mutilation and does not cause any long-term damage. This type is just the minor one. There are four types. There are four types. Four types of FGM. The first one is clitoridectomy. The second type is sonar. The third one is infibulation. And then the fourth one is unclassified. That's how the fourth one is unclassified. Now, this one is the minimal one. Clitoridectomy is a minimal one, meaning that they have removed some of the skin, skin that surrounds the woman's veggie. I may not really pronounce the word, but when I say veggie, you should understand. You understand my point. They have removed that skin, but not all. That's to say, they just took the hood, the other one, and left the other parts. That's for the clitoridectomy. And then the next one is type 2 is sonar. Sonar means removing of the full clitoris and part of the labia minora. The full removal of the clitoris and outer layer covering the clitoris. Here, the clitoris is generally not damaged. It's generally not damaged but has been tampered with. You understand? Hi, Ling Young Edet. Thanks for coming to my class. I'm so happy to see you. You are welcome. You're welcome. Welcome to Trisha's Voice. So, this is what this part is talking about. They have tampered with the thing, but not really deep a part. And then type 3 is infibulation. Infibulation means removing the clitoris, 1. The labia minora is 2. And the labia majora. Minora means the minor ones, the minor part has been removed. Majora means the major part has also been removed. So this is type 3. This also involves stitching. This also involves stitching the vaginal opening with ammonicles, holes for urination and menstrual bleeding. That is to say that they have removed the clitoris. They cut it off. And they have removed the labia minora, which is the minor part. They have removed the minor majora. And they have even gone as far as stitching the little hole where urine and menstruation passes through. Not like they have closed it completely, but they have stitched it. Let's say that this is the hole. The hole is the cover of this my pen. You understand? So you see how long it is. So let's say they have stitched the hole to a half, or maybe a little part, not completely covered. You get? So I'm trying to show you the different stages of the mutilation we have when it has to do with female circumcision. It's in stages. Now the type 4 is the one we call unclassified. You don't know how to place this one. Unclassified forms of FGM may involve pricking, stretching, cauterization, or inserting herbs into the veggie. You know what I mean when I say veggie. In this case, the external female genitalia is removed with most of the labia majora being cut or scrapped away. Scrapped away, or they did not say reduce. They say scrap away. The rest of the labia majora and vaginal opening is sewn together. Now, they have removed all the thing that makes the genital in this part. This type 4. They have removed everything that makes the genital. And then they have even gone as far as stitching the hole. You know that The woman body has a little hole and is open. We all know this one. This one, Patricia, I don't need to come and be saying this one on social media now. We know this one. We know how it is. So they have even removed all the things, the skin that, that makes the whole thing. It's not even enough. They have gone as far as stitching the thing. The natural hole, this hole, mind you, this hole that they are stitching is not like they created it though. It's the natural hole that God gave. It's not like the thing there was a cut or baby came out like the one we will say epitosectomy, or how do we even call it? They will say stage 1, stage 2. It's not like that one. Oh. It's not like that one. This one is the natural hole God gave you. Is what they are stitching to cover the hole again. You see the damage done. So that is why I said we should talk about it today. Now, that aside, those are the 4 types. There are many women that are going through the pains and the stress caused by the type 4, the unclassified. You understand? There are many women going through the type 4, the unclassified, and type 3, type 2, and the number 1. Now note, FGM is a forceful act and is performed with the victim being held down by many women in the society. Now, this act is not something you do deliberately. They will force you into it. They'll force you into it. If you Google FGM, you will see that even children, this act has been carried out among children. You get. So you can see the damage. They are holding your hands. They are holding your legs. They are forcing your legs to be open. Yes. That's what they do. That's how they do it. There's nothing like they will give you anesthesia. There's nothing like anesthesia in this one. Oh. They force you, and they are doing it with real your life open, your eyes open. Real life. Everything in you is life. So you see the pains. You see the torture. Which is one of the reasons why World Health Organization has made a pronouncement that anybody, if they catch you in a prison, anyone that is caught, you're going to prison direct. Don't say Patricia did not tell you. I am telling you now for free that if you try female genital mutilation and you are caught, you're going in for it. Yes, imprisonment. It's not a joke. It's a serious crime against humanity. So I feel I should come out to educate people, mothers, parents most especially, so that they will know. And even children. Nobody should cajole you to do it. Because you will be the one to face the consequences. Of course, the consequences are all here. I'm going to read it out so that you get to know. That's for that. Now, tools used in carrying out the FGM. Somebody will want to ask, how do they do it? I've been hearing about female genital mutilation. How do they carry it out? How do we do it? This is how they do it. The tools are here. Number 1 is kitchen knife. Yes. I'm not exaggerating. No. I'm telling you what I know. I'm telling you what people are going through. Number 1 is kitchen knife. Number 2 is broken glasses. Number 3 is razor blades. Number 4, scissors. Number 5, broken bottles. Number 6, sharp irons. Those are the things. Those are the things they use. When they want to pull those skin out, that's what they were using. You understand? Now, how can somebody use all these objects with someone, broad day life, or broad daylight, with your crow eye? It's disheartening, So, most times, those tools are not usually sterilized before use. They don't. What do you use to sterilize your object? They don't sterilize it. There's nothing like cooking. When you go to the theater of the normal medical setting, those equipment, they cook it to go through fire, to go through all the heat, to go through all the chemicals, a lot of things to sterilize it, to avoid infection and all that. They don't do anything here. And you know the funniest thing? Also, some tools can be used for many persons. That same tools, one person is using razor blade. Let me say a parent wants to carry out this act and there are two daughters or three. Okay, I want to go into fattening room. In the culture, we used to do what is called fattening room. That was then. I don't know if they still do it now, no? Because everywhere is civilized. It's a cultural practice. They call it fattening room. That room is where they will put you inside that room. They will give you food. You will eat excess food. So if you used to eat 1 cup of gari, they will make sure you eat up to 3 or 4 before you come out. As in, they will expand virtually your intestine and everything with food. All just so that you get fattened up. You understand? And that means that you are now a full-grown woman who is ready for marriage. Because the idea is that a man doesn't like a skinny, a slim woman. Let me not just use the word skinny. A slim woman. Men don't like, that's the idea. When you are slim, you're not beautiful. So they attribute beauty to the size of your body. So when you are full, you're robust, you're fat, it means that you're a very fine woman, you're a full-grown woman. Those were the mentality. Those were the ideas in their head, oh. You understand? So, at the end of the day, you see a man will push two women inside the fattening room or the circumcision, whatever. And they are using the same blades. And then their sisters use it. Forgetting that there is what we call individual differences. Forgetting that there is what we call infection. The first may be having infection. The second might not even have. Through the first one, the second will have. So, those are the things. Some persons will say, why would they say they should stop it? Why would people stop it? These are the reasons, some of the reasons. And there are other reasons that are very, very, very outrageous, and we will talk about it. Now, causes of FGM. Causes. When I mean causes, why? Why do people get involved in female genital mutilation? Why do you do it? Number one, the social pressure to conform to what others do and have been doing. Social pressure. Social pressure. By social pressure, I mean peer pressure. We could say age grade pressure. Those are pressures. Those are things. Those are the groups that will pressurize you into doing what you don't want to. Now, the social pressure to conform to what others do and have been doing. My friend has done it. Let me join. Most especially women. Women. The problem, we are the ones facing and we are the ones creating it. Mama Mercy don't put Mercy inside fattening room. Me self, I won't follow put my own daughter. Just to belong. So that when they are rating, that they are saying that when they are rating women in the community, women who are well-to-do. In our today's society, when we want to talk about women who are well-to-do, we want to talk about the kind of job you're doing, the how much you have in your account, the house you live, the investment and all that. That's how they want to classify your class. But then, it wasn't like that. They will look, first of all, how many children do you have, number 1? 2, have you been able to even put your child into a fattening room? Or, yes, 2, that's 2. They don't marry your pikin before. You get. So that's how they rate people. You will hear them saying, Mary Mama don't give out 3 children now for marriage. So they are now rating the woman based on those things. And they see those things as achievements. I'm talking about social pressure. Now, number 2 is the need to be accepted socially. It's still part of what I just finished explaining. So when you are up to this age, they will now accept you. Do you know that there are some groups, even till now, till today, there are some groups that people create, and they will give you their criteria. One of it is that you have to be a married man or a married woman for you to join the group. So my brother, if you're not married, you cannot join. So marriage is a ticket to join that group. It's still happening today in a way. Yes. It's still happening, and they may have their reasons why they don't want people who have not who have no wife. You understand? So they have their reasons. So it's still happening till today. Even if there are some jobs that they will tell you, are you married? You say no, say this job is for a married person. They have their reasons for it. So because of that, you will now be forced to, you were not ready to get married. Maybe you didn't even see somebody you want to get married to. So because of that very job, people do it even till today. You have to start looking for someone helter-skelter to get married to. And the purpose of the marriage is just for you to be in this particular position. So that's for that. Then the next one is the fear of being rejected by community. Yes, I see the same thing. We are looking for somebody who we can, who can be our town crier. And then they'll mention you. They'll mention John. I don't want to use traditional names because people have a way of attributing certain things to certain places. So when I use English name, you know that it's an English name. They want to say it's Calabar, it's Akwa Ibom, it's Yoruba, it's Igbo, it's this. So because of that, I don't even want to mention any local name in my stuff so that you will not, misquote me. That Patricia said. So when I said John, just understand. You get my point too. They will not want to give to John. Number one, John is not married. Is not married. Number two, John does not have a farm. Number three, they will just, so those are the things. And one of the criteria they were using then was this thing I'm talking about. Number 4 says FGM is often considered necessary part of raising a girl child properly and preparing her for marriage and adulthood. You see, in our generation now, all we talk about is girls, young women, children go to school, girls go to school and all that. That's because everybody now knows the advantage of going to school, being educated. But then, their joy and their pride was on how they can train their female child to be a good wife. Marriage was seen as the ultimate. Yes. So if you get to the age of getting married and you are not, they will start conducting deliverance for you. They will start taking you to some rivers to do some incantation. They will start rubbing you some things. You know those. They will start appeasing gods for you because they feel it's not normal for you not to be married. So women and men did a lot to make sure that their female child comes out outstanding, and they feel that one of the ways is this: to mutilate the genital part of the girl child and then push her into fattening room and do a lot of things with her body. You understand my point? So, point 4 says, AGM is often motivated by belief about what is considered proper sexual behavior. See, they feel that by mutilating the woman's body, it will make her behave in a proper way. Do you know the proper way they are talking about? The proper way they are talking about here is that, why am I even speaking grammar? Let me use a layman language. That a woman is not supposed to have urge for sex. That is wrong for a girl child to have urge for sex. If you have urge for that, it means that you are promiscuous. It means that you may not make a good wife. It means that you may not be a good mother. It means that, I don't even know how to say. You may not be able to take care of your body and all that. So what is the solution for them? They remove that thing. Do you get my point? That's why they remove it. There's nothing else. So I don't want to sound very rude, but I was forced to use the word selfishness. God created everyone, created a woman, created a man, gave everybody a unique body. So as a man, you have a unique body. Everything about you is complete. As a woman, you have a unique body created by God. Everything about you is complete. So I feel that because of selfishness, they will say no. 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 And you notice that it is even a taboo then for you to even go and start asking a man for S.E.X. They will say it's a taboo. Because you're a woman, you're not supposed to. You know that belief, that that belief and mentality that you're a woman, you're not supposed to. You're a woman, you're not. So they don't even believe that a woman should enjoy sex. See, pronouncing words. Pardon me. You understand? They don't believe that you should. Which is the reason why when they looked at the situation and then they come into a conclusion that it is this thing that is making this person to be like this. There is something in women's body that is making them to be having urge for sex, looking for men, and then having multiple partners and all that. So they now feel it is that thing inside there that is the cause. So they remove that thing. I'm just telling you, it's a practical thing. I'm just using a layman way of explaining these things to you so that you understand. So you don't even look for the advantage or whatever. You get? Now, FGM is associated with cultural ideals of femininity and modesty. Mind you, it's a cultural practice. FGM has nothing to do with religion. No. It has nothing to do with religion. It is not a religious belief, it's a cultural practice. People just decide to. So whether you are in this one, or some people do, they call it, what do they call it? They shade themselves into different sects. Christianity, Islamic, Baha'ism, Buddhism, Hinduism, all those things. It's not even about religion. It's not about religion. It's a cultural practice. And it's not practiced by everyone. Some cultures accept it and see it. Some do not even practice it. So it's a cultural thing. Now, the feminine and modesty I'm talking about, they feel that when that thing is taken off, the place will be neat. They feel that the place will be clean. Is this part that people don't know? Even women, even my fellow women, they don't know that. See, the woman's body, God created it that way. If you check the veggie, or let me say the genital part of a woman, it's not supposed to be dry. Yes, naturally, it's not supposed to be dry. God that made that place like that knows why. If that place is dry, that one will die. That place is not supposed to be dry. It's supposed to be moist in nature. You get? Do you know why? Let me take this time to explain this small part, or this little part. There is a hole in the woman's body. And when you squat or sit on a toilet seat, or whether public or general or private, the place is open. So it means that there's tendency that some things can go inside. That is why you hear parent telling, like when I was a child, you hear my mom or my dad telling me, "Go and wear your pants, go and wear your pants. Don't always go without wearing pants." They have the idea and they know that that place is not supposed to come in contact with things anyhow because of how the place is. It's not supposed to. When you sit on the floor with it, there may be some bacteria there, and because the place is open, they may find a way of penetrating inside your body. So the discharge inside the woman's body that comes down and drips out has a job, has a duty. There are some antibodies in it that are fighting infection, fighting fungi, fighting bacteria. You don't know about it. And I don't want to talk about the things, the advantage of that. Maybe that will be a topic for another day. We need to really educate our men and our women. So when you see somebody who say a woman is having discharge, it is a normal thing. That is how God created it. Or do you want to even collect the work and be doing? No, I want to know. You want to change the woman's body? You can't change it. That was how God made it, and it's unique. If the place is not moisturized, but how do you penetrate? How? Since God that created that place does not know what he was doing. You get my point? So that's on a lighter note. But then, because of how the place looks like, sometimes you see discharge, Sometimes the place is wet and all that. So many men felt or were disgusted. Let me put it that way. A lot of men were that time, that did not know what that place is all about. They were disgusted. So each time they want to have an affair with a woman and they go to the place is wet and all, they feel disgusted. That why is this place like this? It's looking, you know. But you don't know. That's ignorance. For the people who don't know. But for the men who sabi, they sabi. You get. So I'm just taking out time to explain that it shouldn't be because of that the body is now tampered with. Because of the things you see, you say, no, this thing should not be like this. We can do something. Once you remove the other part, and then the place will be like that, to be clean, to be. You understand? All right, we still continue. I'm still telling the causes. Why? Now, in all some of the few causes I have mentioned, have you seen anyone that is very, very serious that you feel should be considered? If you feel so, you are free to drop a message at the comment box and I'll answer all your questions. Just ask anything. So we move straight to number 6. FGM is often considered a cultural tradition, which is often used as an argument for its continuation. Now, there's some cultures imbibe this very act, and they felt it should remain. So they think or feel it should remain. It should not be scrapped out. Because of that, they have formed a body. There are some persons that each time they want to do this female genital mutilation, they have people already on ground. They will just call. It's just like having a midwife. Somebody's pregnant. The person wants to put to bed. Please call so person to come. It was like that. They formed a body. So when you want to do, you pay them. You pay them money. They will come and carry out the act. And they will tell you that dressing your daughter for you. Your daughter is beautiful. Your daughter's body is fine and all that. Okay, number 7 says, in some societies, FGM is practiced by new groups when they move into areas where the local population practice FGM. Yes, some persons originally, it's not part of their culture. It's not part of like now I'm in Cross River State. So I'm relocating to, let me say, Lagos State. And as I got to Lagos State, this is what they believe, this is what they are practicing. So because I want to conform, I will have to, bend my rules and conform to what they are doing. I'll have to accept it and become a part of it so that they will accept me. I'm telling you the causes. Why? The reason why. Note, what is clear, however, is that FGM is a manifestation of deeply entrenched gender inequality. Yes. What is clear here is that FGM is a manifestation of deeply entrenched gender inequality. Do you know why this point is saying this? Because when you look at the reasons why people go into FGM, you can rate from every indication that it is very selfish. When you look at the reasons, you will get to know that it is only favoring one person. That is the person who is receiving, which is the man. So, in law, you see that that thing that looks like a measurement scale in law. This is my hand, is like this. They are together. It's supposed to be like this. But you notice that before now, the thing was like this. Meaning that this side of the people, or a particular set of people, are up. The other sets are down. You understand? Now, the woman is the one down and the man is the one up. The scale is not balanced. The woman go through female genital mutilation all to please a man that is here. And it's like that. I'm trying to explain the point that says that FGM is a manifestation of deeply entrenched gender inequality. It is the woman that is going through pains to cut the genitalia, labia, minora, majora, and all that. All at the end of the day is to please a man that is up. So the woman is down. And I'll tell you why she's down. She's down because she's the one feeling pains. She's down because she's the one bleeding. She's the one bleeding. And the man is the one enjoying. The man is the one that the body, some of them will say the body should be tight. I don't know what you want to be tight there. So it is the man that is enjoying and the woman is the one feeling pains. That is what that point is talking about. That's exactly what that point is talking about. Now, after that, the man is the one that is to go to school. The woman is the one that is to stay in the house and learn all the chores you get. You have to know how to bath, take care of yourself, how to cook, how to clean the house, how to please a man, how to wash your husband's clothes, and the husband is up. He's the one to go to school and become an engineer, become a doctor and all that. So while the money that is supposed to be for education is spent on the man, you are the one washing his clothes and he's the one going to school. At the end of the day, you're the one carrying pregnancy and carrying baby and the man is the one there. So it was like that. That's why the person is saying that. So you get to know in all of this female genital mutilation topic, consequences and everything, it doesn't favor the woman in any way. It favors only the man. So that's why that statement, that person is saying that FGM is a manifestation of deeply entrenched gender inequality. When we say inequality, it means that the woman is not even in the same rank with a man. Of which I am not. I'm not an activist. I'm not how do they even call all those women who come out to do a lot of things and support. I'm not that. I support men and I support women. Mine is that do the right thing. Do the right thing. If a man is not doing the right thing, he should do the right thing. If a woman is not doing the right thing, she should do the right thing. So it's not about who wins or who loses. We are all human. Everybody should be treated well. That's my own ideology as a person. But in this topic, when we look at all of this, we'll get to know that the woman is at the losing side. And you will see it in the consequences as we proceed. Now, they believe that it will reduce promiscuity among young women. They remove this particular skin, the labia minora, labia majora, the clitoris, hood, and all those things they pull out of the woman's body. All because they don't want her to be promiscuous. They feel that the reason why she's going up and down, following men and all that is that thing. So they have to pull it out. And the question I ask, the man that is having the urge for sex, he is free. And the woman is not supposed to. You know why I'm saying that? There's what we call, there are hormones that controls the body. There are some hormones we call sexual hormones. Those hormones are in charge of the sex, your sex life. Let me put it that way. The feelings you have about someone and all that. I'm trying to bring it down to a layman language so that everybody will understand what I'm talking about. Now, the hormones will send a signal to the woman's genital part. Or, I don't know how, I'm trying not to pronounce the word, but I'm forced to. The hormones, the signal will send signal to the clitoris. And the clitoris will send signal to your brain. And will tell you that your brain will now tell you that you need S.I.sex. And you start looking for a way. It's a natural thing. That's how God made it. That is how God made it. It's a normal thing for a woman to have urge for sex. It's a very complete normal thing. I don't know which word to use again. So, Taking that thing that will send signal to your brain to tell you that you need a man, taking it off. What does it mean? So I'm still trying to justify what that person is saying. You get my point? So that is just it. So now that you have taken the thing that is supposed to bring pleasure to the woman out, and then the woman is still being prepared to meet with the man, when it's time for sex and the man is coming to meet with the woman, it is only the man that is having the urge. It is only the man that is having the feelings. It is only the man who wants it. And at the end of the day, the woman will be suffering in pains. Do you know why? They have stitched the hole. They've sewn the hole. Now I told you when we're talking about types, they have reduced the hole. The hole was like this. They have reduced it. So the man now wants to enjoy it the way it is, so small and tight. And what happens to the woman? She'll be feeling pains and be enduring. So when that person said FGM is a manifestation of deeply entrenched gender inequality, the person is right. I think I have explained enough so that people will not come to my inbox to be bombarding me of questions I don't know. But I will answer you, you get. So that's that. So we go to the consequences of FGM. What are the effects? What are the damages? Number one, it negatively affects the natural functioning of the female reproductive system and violates her human rights. Yes. You'll be urinating, you'll be feeling pains. You'll be having intercourse, you'll be feeling pains. Moreover, it was not even something you wanted to do. You were forced into it. There was a particular point I told you, it's a forceful act. So, those are the consequences. Number one. Number two, the excess pain can make a female to go into shock. You can go into shock when you remember. You know that those things are not like in the normal hospital. They'll give you anesthesia and then you sleep and you don't know what happened and you later wake up. Everything has already been done. You get. But this one, before your very eye, you will see it. You're seeing the object. You're seeing the women and all that. You're seeing the blood. So some people will start having panic attack. A lot of things. Excessive bleeding will happen, which could cause hemorrhage because of clitoral artery or blood vessel has been improperly cut. Yes, it causes bleeding. If you ask our mothers, grandmothers about it, they will tell you. Sometimes when they hire somebody who does not even know the thing to cut and they want to remain, and the person will now come and cut what he or she is not supposed to cut, that person will bleed. It causes death. You bleed till you die. The person doesn't know what he's cutting now. Okay, for instance, now some people will want to cut when you're putting to bed. They will say, okay, when she pushes the baby out, we'll use the opportunity to cut the clit out, the clitoris out, or the labia majora or the labia majora. We'll cut it out, or the clitoris hook. Hood. We'll cut it off. You understand my point? So, but there's something they fail to understand. A woman is pushing a baby out, meaning that she's actually going to lose some blood. As she's pushing out, blood is going out of her body in a larger quantity. Water is going out of her body, and then you use the opportunity to cut another place that blood will still come. You don't even know if this woman has enough blood in her body. And mind you, when a woman is pushing a baby out, the whole body is sensitive. It's very, very sensitive. When I'm using the word sensitive in the sense that everything about that part is very soft. So any little cut goes deep. Any little cut. Even the hair, the baby's hair, that's why they'll tell you shave. That hair alone can cause a very deep cut, because as at that point, your body is open and soft and ready for anything. So any little thing as a cut may cause bleeding. And they don't know. And they do the same thing that same time, which is one of the reasons why some mothers would bleed and die. The bleeding will become excessive because as they are cutting, they don't know what they are cutting. So that is the thing. And then the next point says complication with urination could also happen because in some excessive cases the labia majora is sewn. These ones are short-term risks I'm talking about. These ones are things that you suffer for months, and maybe with time your body will adjust and you go again. But there are some complications and consequences that are major. It means that you have to live with that thing till the day you die. Now, together the block of opening our bladder makes urination very difficult and sometimes just impossible. They will cut the place, remove the thing, sew the thing back. And at the end of the day, you cannot make use of that place. You want to urinate, you're having pains. You're taking too much time to urinate and a lot of things. Those are the complications. Those are the issues. The next one is many infections are bound to happen because of the way the process takes. Infection will happen. Like I told you. If you Google and see the picture I'm telling you, you will understand what I'm telling you. They don't even do it in a clean place because they feel that what they're about to do is dirty. I don't know why such a thing would come to their mind. They don't know about infection. They don't even believe it exists. So the thing they were supposed to maybe keep you in a clean place, a clean house to do, they will take you inside the bush. They do it inside the bush. Google it now. Let it not look like Patricia is talking too much. They do it inside the bush. They will go and cut what's this called, plantain leaf or banana leaf or whatever, how they call it. They will spray it on the floor, ordinary floor in the bush. You lie down naked on it. They will cut it. Everything is done inside the bush on top of that leaf. They will finish everything, fold it and throw. They will bring you out, start giving you hot water, pouring you hot water, beating you hot water, a lot of things, massaging you and all those kind of things. You understand my point? That's what that point is talking about. So infection may come. The women that are even using their hand to be pressing your genital part up and down, they may even be infected with HIV. They have HIV, some of them. And in the course of doing it, that blood may cut their hand. They still use the same hand to do the same practice or do the mutilation. And at the end, it may drop inside your own blood. How about the tools they are using? Have they sterilized it? No. So, many infections are bound to happen. I've already said that. Unsterilized objects. Using non-sterilized sharp object to perform the cutting. Because of this condition, the girls and women are subject to infections. Like wound infection, long-term diseases, like HIV and AIDS. I've already mentioned that, which is caused by contaminated objects. Those objects you see, they will take the object and go and keep in their house. They will not throw it to. When another person calls them for another job, they will carry it. Hello, ma. I want to circumcise my girl. Do you have tools? She'll say, yes, I have. So, okay, come with it. She'll go and pack the ones that she sings how many persons, put inside her bag. They do it. It's a local setting. It's in a village. A local setting. They are uncivilized. They'll carry it and put inside the bag and go there. When they get there, maybe remove their clothes and clean. Because I'm just imagining it. Google, you see the picture. They do it on the bare floor. If you get some pictures, I didn't want to print pictures and bring so that, because of the nature of where my class is taking place. So I can't do it here. But go and check it yourself. You'll see what I'm telling you. And then number 6 is mentally. FGM could be damning to a person. It is bound to cause psychological stress to a person that has to undergo it. Yes. Psychological stress. Sometimes when you hear that they are coming to cut you, mommy has called the midwife, or I don't know how to call them, those surgeons, those local surgeons. Those local surgeons, I don't know how they call how to even classify them. Mommy has already called them. So they will be coming tomorrow, and then you start panicking. You can't sleep. You're restless. The pains, the stress, the blood, everything. So people go into stress. In children, loss of confidence and trust could take place. Children will no longer trust the people that are supposed to care for and protect them because of the pain that has been caused. Yes, they don't trust you anymore because they don't even understand what you want to achieve. So anytime they see you acting that way, they will be afraid. Some will even run out of the house because they don't know your next move. You're supposed to be there to protect them. Why are you doing this? Then the long-term risks, FGM and cutting has major effect on sexual reproductive health of a woman. Yes, it does. It does. I think I would want to end this class here because I still have a lot inside here. I still have a lot here. So I want to say that in our next class, let's talk about the long-term risk. The long-term risk of female genital mutilation. That should be the next topic. We've talked about the short-term risk. We've talked about the types. We've talked about the meaning. And we are still on the consequences. So the consequences is divided into two: the long-term consequences and the short-term. So we have dealt with the first the short-term, the one we're talking about, injury and all that are the short-term. So we are going to talk about the long-term injury in our next class so that it will not be too long. So in our next class, we'll be talking about the long-term consequences of female genital mutilation, and we'll be talking about way forward. We'll be talking about way forward, solution. What should we do? But I would love to end the class by telling you that female genital mutilation should not be encouraged. And it's against the law. If you're caught, you will go to prison. Patricia is telling you for free that you will go to prison. It is time we change and do the right thing. Some of the complications we have now amongst women is traced back to female genital mutilation, female circumcision, or female cutting. Yes. Do you know why I'm saying that? When a woman wants to put to bed, the skin that surrounds the genital part is supposed to help. It's supposed to help. Now, when the baby is coming, you notice that there will be stretches. The veggie will open. Those skins around will help expand, enlarge, helping the body to be open for the baby to come out. It's just like you having an elastic cloth and the one that doesn't have elastic, a stretch cloth and the one that doesn't stretch. If a particular cloth has a stretch or in it, I can wear it, and somebody who is slimmer can also wear it. Do you know why? Because it stretches. But when it doesn't stretch, if I wear it and somebody who is bigger than me wants to wear it, do you know what happens? It will tear. That cloth will tear because it doesn't stretch. That's exactly what happened during delivery. So when you take the things that is supposed to help stretch for the body to be open so that the baby can come out, and you have taken them out, now the body is trying to stretch. There is nothing to support it. It will tear. And once it cuts, it means bleeding. It means bleeding. That is one of the reasons why so many people bleed excessively after giving birth. Go and Google it. Go and check. Ask midwives. Go and ask doctors. Patricia is telling nothing but the truth. So you see why it's bad. And at the end, it is the woman. Women, open your eyes. At the end, it is the woman. So I'll end the class here today. So next time, I will announce the class. I'll tell you the day so that you stay tuned. And for this time, or by this time, or at this time, I want to say thank you. Thank you for being a part of my class. Feel free to ask questions. If you don't want to send them down on the comment section, just inbox me. I've had people come to my inbox to ask questions, and they can testify that I always answer them. I answer you with evidence. If I give you my answer, you're not satisfied, I give you evidence. If you cannot get the pictures, ask me. I have places I will send you pictures of what I'm teaching you. So you don't need to worry. So thank you very much for being a part of my class. At this point in time, I still remain your ambassador, Patricia Godwin, and it's a bye. Bye.